feel that pressure starts to build under my finger. And then we'll just go there. How was your first adjustment?
That was awesome.
Yeah. Hi everyone, it's Dr. Dalton with Seven Bridges Chiropractic. I'm here with our new intern, Max. If you've seen him around the office, make sure you welcome him in. If you haven't, this is Max. Max is a high school student who's interested in chiropractic. He's actually never been adjusted before, so this is going to be his first time going through a new patient visit, getting his first adjustment. So I thought that would be a great opportunity for you guys to see kind of how that goes in the office and make sure that you, just like how he will feel, is extra comfortable with everything we're doing. So what we always start off with is a full consultation before we go into the examination to figure out any red flags that might happen, anything that we need to kind of dive a little deeper into. Max primarily is dealing with some neck pain due to school and all those activities. He also has a little bit of low back pain. So you'll get to see a full thorough examination top to bottom, what I will do, and then we'll go through the muscle work and do the adjustment. So first we're going to start off with a posture screening just to look at any imbalances he has, anything we would want to address with physical therapy exercises afterwards, and then we'll go through the exam. So what I'm going to have you do, Max, is go ahead and stand right about here for me, facing the outside door. Perfect, Max. Go ahead and turn facing the bridge wall. Awesome. And then go ahead and turn back. You're good right there. You're going to stay right there. Just face me. And what I want you to do is take your chin down to your chest. Good. Any pain or discomfort there?
No, ma'am.
Awesome. Go ahead and look up towards the ceiling. Any pain or discomfort there?
No.
Good. And then if you take your ear to, or turn your head so your ear goes down towards your shoulder. Awesome. Any pain or discomfort there?
No.
And then same thing, go in the other direction. Good. Does it feel harder going right versus left?
Definitely harder going this direction.
Yeah. Any pain when you do that one?
Slight, a little bit.
So you've got a little bit of decreased range of motion there. And then where's that pain or discomfort that you're feeling?
Right, low neck, high tract.
Okay. On the right or the left side?
Left side.
Okay. And then what I want you to do is go ahead and rotate your head all the way to the right. Good. Any discomfort there?
No.
And then all the way to the left. Good. You've got really good rotation, range of motion. Any pain going to the left?
No, ma'am.
Perfect. Then go ahead and bend forward like you're going to touch your toes. Awesome. Any pain or discomfort in your low back or mid back with that?
No.
Awesome. And then if you take your arm down your side here. Perfect. And same thing the other way. Any pain with either of those?
No.
Awesome. What I'm going to have you do is stay facing exactly how you are. I'm going to place my hand on your low back, and I want you to bend backwards. Any discomfort or pain in the low back when I do that?
A little bit on the left side.
Okay. Kind of right across where my hand's at, but on that left side. And if we drop this left shoulder, pain there.
Left side, same spot.
And if we do this here.
This side is good.
Good. And if I push down here on your head, does that create any pain or discomfort?
No.
Go ahead and look down to the ground again for me. And same thing there.
No.
And look up to the ceiling. Good. Any pain there?
No.
Go ahead and look up one more time. And we're going to rotate to the left. Any pain or discomfort there?
A little bit.
Lower, kind of here
Yes,
where you were having that pain earlier. Awesome. Same thing there.
This side is good.
Good. Now what I want you to do is arms up like you're a scarecrow. I'm going to push down. Don't let me push down. Perfect. Both arms here. I'm going to pull. Don't let me pull. Good. I'm going to push. Don't let me push. Same thing here. Good. Both arms flat and wrists are going to go up. Perfect. And then go ahead and flip over again and wrist up again. Good. First finger and thumb together. And pinky and thumb together. Perfect. Hands flat and hold these two fingers together. Good. So I just like to go through a whole neurological test. Even though you're not having anything, I like to see if there's any imbalances. We had talked a little bit earlier about kind of numbness and tingling, and if that is something that you're having, it's kind of like that you've stepped on a hose, you're not having that nerve signal. So even if you're not having those type of problems, I like to look at that just to see if we're having any imbalances anywhere. Now what I want you to do is go ahead and lay on your back for me so your head is on the white paper. Perfect. And then we're going to lift this leg here. Any pain or discomfort in your low back when we do that?
No.
And if you bend this knee here and cross over?
No.
Anything in the hip or low back
little
with
bit,
that?
like hip flex.
Okay. Same thing on this side.
Nope.
Good. And then bending crossover here as well.
No pain.
Good. Nothing in that hip either.
Just a little tightness.
Okay.
Nothing here.
Go ahead and hold this leg here. We're going to do like the same thing we did with your arms. I'm going to push down. Don't let me push down. Good. Go ahead and push down into my hand. Awesome. We're going to go push up towards the ceiling and pull down to the ground. Good. Same thing with this leg. Hold strong. A little bit of weakness there. That's not weakness in the sense of like you're not. So what happens is, you know how you're saying your hip flexor feels tight on this side? Go ahead and let that leg relax for a second. When that hip flexor gets really, really tight, your nerve signaling can't tell it to contract anymore because it's already so tight. So what happens is when we loosen that up, and we'll do this test at the end, so once we loosen that up, and you'll gain all that strength back in that. So it's not that you are personally weak there, it's that that muscle is so tight that it will always show up as that weakness unless we can lengthen that muscle. Does that make sense?
Yes, ma'am.
Good. Now go ahead and push down into my hand here. Awesome. Go ahead and kick up towards the ceiling and pull down to the ground. So you can tell you're way stronger than me in every aspect with that. You should be able to. Hold right there. I'm going to pull down. Don't let me. Good. And then push down into my hand. Perfect. So I'm not going to adjust your neck yet. I just want to kind of feel what's going on in it. So you can feel when I touch there. Is that a little tender under my finger?
It is.
Yeah. And probably right there too.
Yes, ma'am.
Yeah. And you said sometimes you get some pressure at the base of your skull.
Yes, usually on the left side.
Yeah, I was going to say right there too. Yeah. Good. Go ahead and roll over face down for me. And then right next to your face actually is going to be armrest. So right there. Perfect. And if I bend your leg here, any pain or discomfort there?
No.
Good. If we go here,
No, ma'am.
and if I come out here.
No.
Perfect. And if I put pressure through that low back.
No pain.
Good. Same thing on this side. Any pain or discomfort there?
No, ma'am.
Good. Here.
All good.
Perfect.
Same. A little bit of pain.
Right under my hand, like right in through here. So I know I can feel this. You might even be able to see this on the video. When I push on this side, and you can feel it, Max, too. You can feel it. You're really bouncy and springy. When I push here, like there's no give there. Bouncy, like there's really nothing. So that left SI joint is what's kind of creating you that pain in your low back from it not moving well. Like it's just kind of restricted through there. All right, go ahead and come up to a seated position for me. Just a second to scribble these down so I don't forget everything. Awesome. All right, next. So what I want to do first is step behind you and start to loosen up your upper back and your neck muscles. And then I'll have you lay on your back. We'll work through all your neck muscles. And then we'll kind of work through your neck muscles, your upper back. I'll adjust your neck and your upper back. And then I'll have you roll on your side and we'll start to work through that hip complex from where you had some of that weakness that presented. We'll adjust both sides of your low back, and then we'll kind of retest that to see how everything's feeling.
Got it.
Sound like a plan?
Yes, ma'am.
Any questions for me?
Not at all.
Perfect. I messed your collar all up. So tell me, what's your favorite class in school?
I would say history, AP Euro is pretty interesting. And then AP Gov is up there too.
Dang. You like those classes and you want to go into the medical field.
A little bit. I wish I could go in like history, but
Yeah.
it's not much for me to do.
So what intrigued you most about chiropractic?
For me, it was kind of like the fusion between knowing the medicine and knowing the business field, which I kind of both debated about going into both of them, and I kind of like the combination of the two.
Yeah. And what other professions are you currently thinking about?
Just business in general, and then as far as medicine goes, maybe dental or podiatry.
Yeah. All great professions. Max is the president, correct, of your medical club at school, which I think is amazing. That's awesome. And what are you guys doing right now to kind of help prepare people in your club for going off to school?
Right now we're kind of focused on recruiting people. The clubs haven't started up too much, but our plan is more to have a couple doctor guest speakers come in, arrange a fundraiser for Wolfson's Children's Hospital,
Nice.
and see where we go from there.
I love it. Wolfson's is only a couple miles down the road from us here in San Marco. It is an amazing children's hospital. We're really lucky. We are down in our downtown area. We have a great complex of hospitals. Good. Go ahead and lay on your back, Max. So you guys probably see me reaching over here. This is just a nice Palmer's cocoa butter. It's so I don't kind of tear up their skin as I'm working through their neck. It can be a sensitive area as is, so I want to make sure that like if you were to go get a massage, you're getting, you feel that I'm not ripping your skin off. Feel a little more tender on this left side.
Yes, ma'am.
And try and let your head just relax. I know I throw it on you not only on your first adjustment, but hey, I'm going to throw you in a video, so it can be a little nerve-wracking. I just could see out the door, and it is still raining. I think we are gone like 3 weeks straight with without a single day of
every afternoon.
It's different than just a thunderstorm in the afternoon, man. It's been just so rainy. My husband finally got to mow our yard yesterday for the first time in like 3.5 weeks.
Yeah.
I came home at lunch and I was like, oh, it's starting to rain. I'm going to mow. And I got home and I was like, yes, you came home at lunch and mowed. Yeah, 'cause it was the only day I came home and our whole yard was a swamp.
Oh my gosh.
It was underwater. So what I'm going to do here is we're going to flex your head. We're going to rotate here. And you should you kind of feel that pressure starts to build under my finger. And then we'll just go there. How was your first adjustment?
That was awesome.
Yeah. Go the opposite way too here. Do you know that there's a decent amount of kids that go into chiropractic school that have never been adjusted starting their first day of chiropractic school? And I think it's amazing. Like, I would have never thought to go into a profession if I'd never had it done before to me, or like never had seen it or been there. And so now you can say you're not one of those.
Yes, ma'am.
All right. So here, what I want you to do is just crisscross your arms. Deep breath in for me, and let that all the way out. Good. And then go ahead and roll on your side facing the bridge wall. Awesome. Stack your hips just a little bit more for me. There you go. Are you ticklish by chance?
Extremely.
Okay, so if you didn't know this, you can't tickle yourself. But the area to get into your psoas muscle is a very ticklish spot. So what I'm actually going to do is have you place your hand there, and then I will place my hand over it so you aren't as ticklish. And then go ahead and let that leg come all the way back. Okay. Move that hand down just a little bit. Feel how tight you are through there?
Mm-hmm.
So you should be able to way past break parallel. And do you feel how like that resistance where your leg will not come back any further? So that's that really tight psoas muscle. Your glutes aren't too bad. Here. And then on your other side. Your body was raring to go right off the get-go. See how much further this leg wants to come back, how easy that is. Let me borrow this hand. You're bracing too much. There you go. You can let that arm relax. There you go. Completely straight with this leg. There you go. And then go on your belly. Big deep breath in for me. Let that all the way out. Good. Awesome. When you're ready, you're good to stand on up for me. Once you move around a little bit, how does that feel?
Feels better.
Yeah. Now if you take your arm or your head to your side each way. Much better. Range of motion there. Go ahead and lay on your back for me one more time. Let's see. Bend this knee again. Hold strong. I mean, I can't push any harder than that. So it shows you how super tight low back muscles can present as that weakness, which will in turn lead to, if that's being weak, you're not able to stabilize your low back as much, which can create more low back problems. So, all right, let me give you one last hand up. Thank you guys for watching. We hope that you learned something with this today and that you can see kind of how our office works. We want to make sure that you feel extra comfortable every time that you come in, whether it be your first visit or your 15th visit. So if you can, go ahead and comment below any questions you have and then subscribe to our channel.